We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Nishnawbe, Ishkildwen, and Nishnabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Good evening, everyone. We'll call the meeting to order. It is precisely 5:01 for the Board of Directors meeting on December 7th, 2023. If I can please have any declarations of conflict of interest. Okay, seeing none. I will move to item 3, previous minutes of November 2nd, 2023. Assuming everyone's had an opportunity to review the minutes, asking for a motion to approve, please. Paul and Michael, thank you. Any amendments, deletions, comments on the minutes? Okay, seeing none. All in favor? Okay, that motion carries. Thank you. To item number 4, report of the President and CEO. Over to you, President Mouget.
Thank you, Madam Chair. I will start my slides. It's going to be a joint presentation to myself and Karen Riddell. I'll talk about what's happening first with respect to respiratory issues in our community and how it's impacting Windsor Regional Hospital. Then Karen will focus on the criminal cyber attack restoration efforts and some progress the team has made and what to look forward to over the next couple weeks. So first, you'll see this is the best data that is available, and we've been relying on this actually from the start of the pandemic regarding wastewater levels. And you'll see the wastewater levels for COVID-19 in Windsor, Essex, unfortunately are moving up to levels we haven't seen since April of even last year, and they're even greater than April of this past year. So a high level of COVID in the wastewater, and as we know, when it's in the wastewater, that means it's in our community. Also, what we're starting to see in wastewater is actually the start of influenza. So there's been, as we kind of predicted, we would start seeing an increase in influenza in the month of November. And in fact, now it looks like it's starting to increase rather rapidly in the wastewater where we have influenza A. And provincially, what they're indicating is we're going to start hitting some peak season for influenza over the next couple of weeks. Will be where we're going to be seeing a dramatic increase. RSV is it was high early December, and it's gone down a bit, but it's still present. And that's consistent since our last board meeting. Is we had a number, I think it was in around 9 children at any given time admitted to the hospital with RSV. Now we're down to 3 as of yesterday. We've only had 1 pediatric test positive for influenza. So we're probably going to start seeing that as well with respect to not only COVID continuing, but RSV and influenza continuing as well. So if you look at what's happening across Canada, the solid line here is this particular year. And you can look at last year as this dotted line is 22-23. And as we had talked about over the last couple board meetings, is last year was an early year for influenza. It looked like we were going to be about 2-3 weeks behind, and sure enough, we were with respect to the start. Hopefully, the peak is not as high as last year. We shall see. It oddly enough flattened out, which is something that generally you do not see. But again, because of what we're seeing in our wastewater and also what's being predicted is we're going to start hitting some higher levels of influenza over the next couple of weeks. Again, hopefully it's nowhere near as last year, but we'll have to see how it takes off. But again, it looks like it is definitely a later influenza season than last year, more typical to the average start of influenza for the last 10 years. And again, hopefully the peak is not as high, but we'll have to see. So as a result, what we're announcing as of 12:01 Friday, December 8th, which is tomorrow morning, we're going to be putting in masking rules for visitors when they actually are in a patient's room visiting the patient. Up to this point, we've been highly recommending visitors wear masks. It is now going to be mandatory. So when they're in the patient's room, they're going to have to wear a mask. Our staff have already been doing that since October. But again, we're going to increase it for the visitors. Again, this is a gradual increase in masking. Hopefully we don't have to increase it past this point, but again, while you're visiting, we're going to be requiring visitors to wear masks in a patient's room for the protection of not only themselves, but of course the patients. The other thing I want to highlight before I hand it over to Karen is some news regarding the positive impact of the nurse police team. For the first 29 weeks, they've helped close to 800 individuals in the community. Again, the nurse police team is a program that runs Friday, Saturday, and Sunday nights where a nurse from Windsor Regional Hospital goes with a police officer from Windsor Police, and they go to where individuals are at in our community. And we have seen a rather substantial reduction in ED visits from those individuals that we have come in contact with. So they've come in contact with, again, close to 800 individuals working those 3 nights from 1 p.m. to 1 a.m. for the 29 weeks. And about 40% approximately reduction in ED visits, meaning individuals who they've actually come in contact with. We trace their ED visits prior to the contact as compared to post, and it's been a dramatic drop off with respect to ED visits. So very, very positive. They'll be able to see individuals in the community. And one of the biggest issues you'll see is the 64 substance-related wounds. If we can deal with wounds in the community before they require emergency treatment, that's positive, and they can follow up with these individuals to make sure the wound is clean and doesn't get infected and doesn't require an emergency room visit or something possibly worse. So again, very positive. We are going to be looking at expanding this program to 7 days a week because even though we started the program Friday, Saturday, and Sunday nights, we're seeing there still is a demand, of course, the rest of the week. So stay tuned with respect to further highlights regarding the nurse police team, but really want to thank our staff at Windsor Regional Hospital and the police for quite a partnership. And just recently, a couple of our staff members, Jonathan Foster, as well as Windsor Police, were invited to present at a conference on this very subject in the United States. And they presented, and they were keynote speakers at this conference, actually, to speak about the nurse police team. So kudos to the team in regard to that. So now I will hand it over to Karen Riddell, who will give an update with respect to the restoration efforts post the criminal cyber attack. Karen?
Thanks, David. So just an update on the activities over the past few days. So On a positive note, we have started as of December 2nd, both registering and discharging patients in our electronic system that were admitted and discharged during the downtime period. And this is necessary to be able to build onto those charts. So all of our paper records that we have kept during this downtime will need to be scanned and uploaded into that system. Starting on December 7th, we have started registering our current patients and entering current treatment plans and orders. And we are planning to go live with our electronic patient health record on December the 13th. So over the course of the next few days, we have a very detailed plan where each program will be entering their patients in a systematic way. With the plan that we will actually turn the system on Wednesday and be back to electronic charting. So the staff and our professional staff are very excited about this, and we're very much looking forward to getting back online. If you could flip to the next slide, David. So it's important to note, though, this is not a full restoration of all of our electronic systems. We have hundreds of different systems that integrate into the electronic health record. So some of them will not be fully electronic or integrated. And I just want to highlight a few of these that are a bit of a larger impact. So from a pharmacy perspective, we utilize medication dispensing units. We use Pyxis units. So these are the actual machines that our medications are dispensed from in the patient units. So they are working, they're just not integrated with the computer system. So right now, when a physician enters an order in our computer system, it would flow to pharmacy. Pharmacy would verify the medication, and then it would flow into the Pyxis unit. And then we would be able to electronically dispense those medications. So those machines will continue to be on override for about one more month until we get that fully integrated into the record. From a lab perspective, again, our orders will flow from our electronic record into the lab, and the lab systems are working, but we will not be able to feed those results directly into the health record electronically. So those results will continue to be faxed back to the units, and then they will be scanned into the record. So that's going to be about 1 to 2 more weeks before that's fully integrated. From a diagnostic imaging perspective, our PACS system is not yet up and running. And what PACS is a picture archiving and communication system. So the system electronically stores the images and the reports. And instead of using the old method of manually filing, retrieving, and transporting the film jackets, you might remember the old X-ray films and things that people used to hold up to a lighted system to analyze. So that's what this PACS system does with digital images. And it allows a chronologic view of a patient's radiology history. And it also provides remote access, which is very important. So both our on-site physicians, our on-site radiologists can access images from anywhere in the building or at either site. And it also makes them available to physicians in our centers that we are referring our patients to. So physicians in Hamilton can access our images for patients that we are referring to Hamilton or Toronto, London, and vice versa. So that's a really important system that we need back up and running, and we are hopeful that that will be back up in just another week or two. And if you can go to the next slide. So I want to talk a little bit more about diagnostic imaging because it was one of our heavily impacted areas during this code gray because it is so technologically dependent. So how we prioritize diagnostic imaging is based on a system of 4 different urgencies. So there's priority 1, which is emergent and needs to be completed within 24 hours. Priority 2, or urgent, is something that should be completed within 48 hours. Priority 3 is semi-urgent, and those should be targeted to be completed within 10 days. And then priority 4 is non-urgent and to be completed within approximately 90 days. And you can see that ranges from illnesses and diseases that are immediately life-threatening to those where the image is just required for a diagnosis, but it's not something that is life or limb. Next slide, please. So with that, when we're looking at where we're at currently with regards to getting these types of studies done. So for the priority 1 and priority 2, we are running at 100% capacity. And there was no impact on the volumes of the procedures that we were doing during the code gray. So we maintained those. For P3, we have returned, so our semi-urgent, we have returned to 100% capacity for our CT and MRI. The initial impact of the code gray did result in a backlog, and that was due to our PACS downtime. But once our PACS is back up and running mid-December, we're going to be able to ramp up. And we expect that we'll be able to backlog or clear that backlog of our P3s within approximately 10 weeks. For our P4 or non-urgent, we have not been completing any P4 CTs or MRIs, and we don't expect to be able to ramp up for MRI until January of 2024 and CT until February of 2024. So once our PACS is up and running, we are concentrating on our P3 backlog, which are those semi-urgent cases, typically cancer-related cases, or more urgent diseases that need more immediate follow-up. So what we've done during this time period, because of course it's very difficult if you're waiting for imaging for diagnostics, we have informed all physician offices early on in the code gray of the potential impact to wait times to make sure that any patients that clinical condition was changing or there's a change in priority could either be expedited locally or redirected to other hospitals for imaging, or if they're appropriate to wait as some of the P4s would be. And I do want to share a phone number. So if anyone has any questions about a referral that their physician has sent to us and are concerned about delays or have questions about when they might be booked, please feel free to contact our diagnostic imaging department directly for information at 519-254-1727. And we'd be happy to help you with that. And certainly happy to work with your physician in the community if another resource is required. So, and then I think there's one more slide. So this is just to kind of give you a sense of just a few of the forms. There's a whole other table down the side of this room and at the back of this room with the numbers of pieces of paper that we have had to put back into circulation to support our patient health records and the complexity of what we're doing. And I'm sorry to Mother Earth. I'm pretty sure that we didn't help with the potential for global warming during this code gray, but I just want to give a shout out to all of the staff that have really worked night and day to get us through this, and we're happy to see some sun on the horizon, and hopefully we'll be getting out of this soon and being able to provide better care to our community. So thanks to all of our staff.
Thank you, Karen. So, Madam Chair and the board, that's our report. If there's any questions one might have, we're able to answer them.
Okay, thank you, David, Karen. Appreciate the update. We're moving in the right direction, that's for sure. Any questions from the board?
Yeah, and I know I provide, the board and everyone else for that matter, we provide daily updates and there's communications going back and forth on the daily updates. So none of this is new. But from the community point of view, it's positive news. And I just got to reiterate the amazing work our staff does. They do on a daily basis, just phenomenal. So it's just, we can see the light now and move towards it and get some of more of our applications up and running one by one.
Again, thank you, Dave. Karen, please pass on our appreciation to the staff. And The daily updates, sometimes hourly updates, are greatly appreciated. Although our text, my text messaging is going off I think I have more texts in the last few weeks than I've ever had. We do appreciate the updates, so thank you, David. Okay, that was for information, so no motion is required. And Karen, that covers off your CNE report. So that brings us to item 6, Schulich report, Dr. Jacobs.
Thank you, Madam Chair. Very brief report. You're all aware that we've been gearing up for our accreditation visit. It is now finally complete. The accreditors have come through Windsor and met with all of us, and we'll get our formal report, the official one, in the new year. We'll expect the informal report at the end of the week, but by all intents and purposes, all of the feedback was nothing but positive. You know, it's a good sign when they start asking you questions about how to set up their own distributed campuses at their own sites. So I think that the Windsor field went very, very well, and we're very excited about that. I've mentioned before about our growth at this site as well. Our internal medicine residency program is launching officially in July. The applications are now open. We only have 2 positions available, but I can tell you that we had hundreds of applicants for those 2 spots. And so we are very excited about what this means for what we're able to do here and the growth that will be coming. So it's a lot of good news stories. Our 4th-year students are currently in the process of their applications being filed. They'll be hearing about their interview requests in January, and hopefully by the time that we chat next, I'll have a bit more good news about that as well. So it's all positive for me. I'm very happy that the computers are turning back on as well, because I am on call tomorrow. So thank you.
Thank you, Dr. Jacobs. We need the good news. And congratulations on the successful accreditation. We had no doubt that it would be a success. So thank you for that. Any questions for Dr. Jacobs? Okay, seeing none, that was for information, so no motion is required. And that moves us to item number 7, the financial presentation, Anthony, of November 27th, 2023.
Thank you, Madam Chair. Just so everybody knows, we actually did not have a Finance Audit and Resource Committee meeting on November 27th. We did cancel it due to the issues associated with our Code Gray. So the information that I will be providing is new to many of the folks on the call. So I will go through it. If you want to move to that next slide for me. So biggest impact currently from Code Gray. Thankfully, our Cronus timekeeping system is still up and running. This enables our employees to swipe in and out normally. This is probably the only normal function at the hospital currently, or fully normal function normally. So kudos to the team for realizing this early in the game, and they were able to pay all of our employees as normal. So great job to the team there. That does not mean it was a simple task. It was hours and hours and hours of extra work associated with that, getting out checks, etc. So next up, we have our revenue software interface with Cerner. So this is still not functioning, and it hasn't since October 23rd. And then we also have our Infinium general ledger system, and then our Transform accounts payable systems, all still not working. So you can imagine the amount of paper that is being hoarded by the accounting staff. This is actually a nightmare for them, and soon to be our auditors, I assume. But they do have stacks of paper, and they're ready when the systems are back up and running to get all that stuff input. Last but not least, we have, what else did we get? Essentially just still no access to the payable systems, amortization systems, etc. So again, we are working on fixes. I do not have a timeline for when those will be up and running. Obviously, patient care is number one. Financial systems are currently on the back burner. Again, a lot of Excel documents happening currently, and we are moving in the right direction to get numbers, reasonably good numbers, to the board in our January meeting. So next slide. So probably one of the more exciting announcements since the Code Gray occurred, WRH will receive one-time funding for the ONA bill reopeners. So that's $10 million in one-time funding. Does it pay everything? No, but it's definitely a step in the right direction. So it's great that the government was able to find these funds. Our hardworking staff are still trying to find other ways to mitigate the results of the ONA reopeners and multiple other unions, and obviously other staffing awards to come. So we can move to the next one. So with that being said, if you scroll through the numbers, probably the most important two numbers we have on this are our deficit from hospital operations. Currently, we're at a deficit of $18.9 million. That equates to about 2.5 days worth of expenses to the hospital. The budget obviously is 11.9. We are still trying to find ways to mitigate that. Hopefully there's a little bit more one-time fundings in the works. Then as we scroll down, we have our net surplus deficit after building amortization. So that's $19.7 million. Again, most of this is due to increased staffing costs over the last year. And last but not least, we have our hospital margin of approximately, we'll say, a deficit of $15 million. Again, and that's in comparison to that budgeted number of 7.9. So we can move to that next one. All right. As you can see, again, year-to-date expense variances. So medical staff fees, 4 million, wages and salaries and wages, 4 million, med surg supplies is 1.9, with our net of 1.5. Again, these are some of our bigger variances to date. So just so you know, that salaries and wages number, that 3.9, those are collective bargaining settlements on top of the ones we had already expected to date. So there were a few more that we didn't anticipate. And I believe that is all I have for tonight. Again, we should have better numbers, more complete numbers in our January meeting. But again, kudos to the accounting team, the finance team, payables, payroll, everybody is jumping in with both feet. They have done a tremendous job keeping the hospital running in the background. It's amazing how much the accounting and finance staff really do at a hospital. So kudos to them for all their hard work and keeping, and probably one of the most important things, keeping everybody paid and paid on time. So thanks, Melissa, and your whole team. Appreciate it. With that, I will just move my consent agenda.
Okay, Anthony, are you asking for a motion to approve the financial presentation?
Oh, yes, sorry, I will move.
Okay. Move that first. Would someone like to second that? Lori, thank you. All in favor? Okay, that motion passes. Thank you, Anthony. And now would you like to move your consent?
I sure would.
Okay, perfect. Can I have someone second that motion, please? Mary, wonderful. All in favor? Okay, that was everyone. So that motion also passes. Thank you, Anthony.
Thanks, Madam Chair.
And tab D is the correspondence and printed matter in your media reports under tab D. Item number 10, and that's for information only. Nothing under item under 10. Board member questions, comments, or notice of motions, unless there's anything that's new. Okay, seeing none, that moves us to our next meeting of Thursday, January 4th in 2024 already. So that will be on Zoom, and I will ask for a motion to adjourn the meeting, please, at 5:31. Penny and Anthony, all in favor? Thank you so much. And I do not believe that there's any media this evening, so we can log right on to the in-camera after this. So thank you. We'll see.